Hey everyone, this is Humanity Chats with Marjy. Thank you for signing in. Thank you for watching. Welcome to our YouTube viewers. Welcome to our Facebook viewers. If you're here on Facebook, please share this with your network. We're going to have Dr. Bingham of South Carolina speaking to us tonight. We're going to get to know her a little bit. We're waiting for the numbers to pick up a little bit before we bring Dr. Bingham to the studio. Okay, what is Humanity Chats? Humanity Chats is just a conversation talking about everyday issues that impact humans. And we do this on Thursday evenings. We just get into the chat room and we talk about everything. Sometimes we talk politics. Sometimes we talk healthcare. We talk racial inequities. We talk about COVID-19. We've had a program for breast cancer awareness. It's a whole wide array of topics that we talk about. The most important thing is the human factor. We are all humans, and we get together on Humanity Chats. We focus on talking about humans. Although we have discussed politics, we are apolitical. And so what we talk about in politics is what? The human factor. Now, we're so glad that you're here. We're starting a little bit early today, so our numbers are now picking up. I haven't even been able to share on my social media yet. So please help me out. Share this. Have a watch party. And if you're watching, hey, we're here for your comments. Let's see where you're watching from, whether you're watching from Bowling Springs or Spartanburg, if you're in Inman, if you're in Greenville, if you're out of South Carolina, let us hear from you. Dr. Bingham is ready for you with her questions and her vision for South Carolina. Earlier today, we had Senator Scott Talley, who is the incumbent, and he spoke to us about his vision. He talked about the economic future. He talked about education, how he's handled COVID-19, racial inequities. And we're going to talk to Dr. Bingham about pretty much the same things. But in addition to that, we're going to get to know a little bit about her, why she chose to be an OBGYN. And she is a mom. I saw her family picture, y'all. She's got some beautiful kids. I think we're getting ready to bring Dr. Bingham in here. I see we have a few viewers. Hey, guys, please share, because I haven't been able to share, and we want people to be able to know what Dr. Bingham has to say to us. And so we're going to be bringing her in shortly. Let's go. Hey, hello everybody, it's Marjy again. We're here with Dr. Bingham and we're going to get to know her tonight. Hi, Dawn.
Hi, Marjy.
It's good to see you. Now, before we get started, guys, I did tell you, let us know in the chat room where you're watching from. We would love to know that. And also, if you have any questions or comments, please don't hesitate to put it in the chat room. Dr. Bingham is available to answer your questions. We are already 5 minutes into this event, and we only have 30 minutes. And so let us know, and whatever she's not able to get to, she is accessible, and she would make sure she answers your questions. So, to get started, Dr. Bingham, you want to tell us a little bit about yourself?
Yeah, sure, Marjy. Well, I am part of the west side of Spartanburg. Marjy and I have known each other for a long time because we have been going to church together for probably 15 years at First Pres, where we've had the opportunity to work on a number of things together, number of projects. But I'm a wife and a mother, but also an OBGYN physician. I love living in Spartanburg, and I love being both a community advocate for the things that we do together in church, but also the things that we do out in the larger community that helps move us forward.
Well, thank you. Thank you, Dr. Bingham. It feels weird, me saying Dr. Bingham over and over again, but it's a formal setting, so I figured I should say Dr. Bingham a lot.
We've been in a lot of committee meetings together, for sure.
Yes, we have. Yes, we have. And, my first question to you is, what are your goals for South Carolina and your district?
Yeah, that's a great question. When I chose to run for office, it's an extension of the advocacy work and some of the legislative work that I do. But it's because I feel very strongly that South Carolina is poised to make some changes and poised in the best way possible. We've all had a very challenging recent past with this COVID pandemic, for sure. And that's still ongoing, and people are recovering from that because we are very resilient as a community. But there are a number of other things that are happening while that's going on. We know that hearts and minds are changing in our community as around racial equity. We've had so many conversations about that. We see that happening in medicine. We see that happening in education, where we're talking more about these things. And I know that South Carolina is ready to make some of these changes. But in addition to that, I know that when our economy starts to come back and come back strongly, we have the opportunity with some of the legislative changes that are going to happen to have people in place to have conversations that are more balanced, which is one of my goals for South Carolina, more diverse, which is one of my goals for South Carolina, and more forward thinking, because what it takes to have great problem solving is to have different minds and different lived experiences around the table, bringing those lived experiences forward so that they can be resourceful in talking about these things and making budgets happen.
Wow. Okay. Thank you for sharing that. So there, viewers, you have Dr. Bingham's vision for South Carolina. Now, my next question kind of just leads into your answer for the first one, and it is, what difference will you make in the lives of the people of South Carolina and your district?
Yeah, that's a great question too. I like to think that in my role every day as a physician, I make a lot of difference in the lives of the people that I take care of. But that's one individual at a time, one family at a time. And I was actually on call last night and had the opportunity to have 3 families, have 3 babies, and it's wonderful. I love the work that I do. It's so rewarding, and I love it. But knowing that sometimes when there's problems that happen inside of medicine that repeat themselves over and over again, there are problems that can happen that can be fixed further upstream, and that happens with legislation because we can put policies into place that affect broad swaths of our population and not just the individual, and that takes care of the community at large. So the difference that I'm looking to make in the lives of people is to bring my lived experience of public health, the way I see things through a public health lens, to all aspects of legislation, and to bring the fact that I'm an OBGYN and a physician, as well as a working mom, into the conversation, because we know that it takes having people with lived experiences to bring things forward and have a narrative inside of those legislative bodies to basically give life to the policy that's happening and to talk about what the stories are and the people that it's affecting, because data is great and I personally really love data. But sometimes data is not the thing that changes people's minds. Sometimes it's the stories and knowing how it affects the people downstream when something is happening upstream that makes people actually stand up and listen. And I have a very good example for that. And that was the recent lactation support bill that I helped to get passed. We worked on that bill for 3 years. And when it initially came out, it had bipartisan support, but it didn't have a whole lot of momentum because it just didn't have the same impact at that point in time as when it did later, when we got more information and more narratives and actually got businesses on board with the Chamber of Commerce to send out an email to all of their members and say, you know, who is breastfeeding friendly? Who would like to self-identify like that? And if you do, why? And what's the economic impact it's had for your workers? And when we got that information back and had narratives from businesses about how it affected their employers, then it was much more interesting to the politicians and the legislators to listen to that and have some more interest in moving that forward. So it moved forward eventually, and Representative Rosalind Henderson Myers was obviously instrumental in that. That was her bill. But the big thing that I learned from that is that having a narrative and making it make sense in the story is just as important as having that data. And as a physician, I have thousands of narratives and will continue to have those narratives about what's happening in my patients' lives and how these policies and procedures, they get affected with those patients and how it happens. So those are very important things for me as far as looking forward, how I can make the difference in the life of people in South Carolina. And then the other aspect of like just the fact that she brought that forward, that was kind of a no-brainer piece of legislation. It's good for moms, it's good for babies, it's good for businesses. And it took a woman who had lived that experience to bring it forward as a piece of legislation. And that's the kind of diversity that I'm talking about. And I actually had the opportunity to listen this summer to a great talk, actually by David Britt on council. And he was talking about, he's on the task force with COVID. And he was talking about how they recognized that the department was going to need to diversify and not just stay siloed in one industry or another if we were going to continue to move forward. And I thought that was a really good example, and it stuck with me even from back then. I think it was like July sometime, that diversification is very important to having better problem solving. So more people that have different lived experiences around the table are in the State House is probably the way to do it. And I hope I can make a difference in the lives of people in South Carolina. I'm certain I can.
Well, thank you for sharing. You know, from my experience, I know that when you share human interest stories, you do make an impact.
Yes.
You know, I lately I've been writing a lot, and
I know. I love it.
Oh, thank you. I've been putting human interest stories in there, and it seems to really resonate with my readers. And so, thank you for sharing that. Well, questions, Dr. Bingham. Economic opportunities. You know what's happened to not just our state and our country, but to the world. With this pandemic and the loss of jobs and businesses having to close shop, what is your vision for economic opportunities in your state and your district, and even, if I may go further, for the United States?
Yeah, so I think probably the biggest thing that we need to think about with economic opportunities is the fact that at the end of the day, everybody wants to be able to have a job where they're taking care of themselves and taking care of their family. That's something that everybody shares. Whatever your position is, whatever your desired profession is, that's a thing that everybody shares, is the desire to be able to take care of themselves and take care of their families. And so we know that when you provide people with a good workplace, you provide businesses with a strong workforce, that is a winning equation for everybody. And I think that was very well underscored during this pandemic, that businesses, we need them to stay open. But for them to stay open, they have to have a healthy workforce. And for them to have customers, we have to have a healthy base of customers that are not afraid to go out in public. And so solving the problems of this pandemic, as multitude as they are very important for economic growth and forward thinking for both the people who need jobs and the businesses who need a strong workforce. Now that's just currently, right? We just need to have people healthy or safe. I mean, we have to have them as we're moving forward until we have things that are more in line and we have a better solution completely. We need people to be able to be safe when they're going to work. And so making sure that we provide for that and we have policies in place that will also provide for that, very important for our current economics. And we think we've recognized that because places, for instance, jurisdictions that have had mask mandates, we know that they've had lower rates of COVID-19. So what that means is more people who are able to go to work, more people who are able to shop, more people who are able to go into schools. And so the businesses do better when we have a healthier population. So making sure at this point in time that we look at that and address that appropriately. But on a bigger scale, if you step back from that, before the COVID pandemic had happened, the things that are important is making sure that we're educating people in the places that they need education, and making sure that our workforce is developed along the lines that are in line with what our goals for the growth of different businesses are. So that if we have people that need better education opportunities in trade schools, that we're providing for that, and that we have other pathways to education that are in line with the growth opportunities that we have here. And one of those things is also the clean energy opportunities for jobs, because that is a huge industry in our country right now. And it's something that, because of our wonderful resources here in South Carolina, that we would be able to take really full advantage of. And I think that workforce development, when it goes along with clean energy, would actually be a boon for South Carolina.
Well, thank you for sharing that. And, I have another question.
Yeah.
In order to get all this to work, you would need to work with a team. You would need to collaborate with your colleagues. How do you intend to do that?
So there's no other way to do it, right? Because we have to have an incentive to work across the aisle so that we are able to be talking to each other and meeting the expectations and goals. So if you're having a project in mind, and when I put teams together for different projects, we have to align what our goals are with what our expectations are, and both sides of that have to be in line so that we can move forward. I don't see another way of moving forward except to work together. And I think that having a balance inside of the State House of people who have both different mindsets of how to do it, but are of the same mindset that it takes working together, is the only way to do this. And so I do that now every day. We have collaborative teams that are multidisciplinary because we have difficult cases or we have difficult projects that are going on. Some of the things that we do with the grants that we get inside of the hospital, we have to bring in people who are very diverse thinking, people who are from billing, people who are from finance, people who are from patient aspect, people who are from the clinical aspect, all moving forward to a similar goal. And we have, a lot of times there's a lot of money on the table. And so this is not something that we can take lightly, and something that we actually have to plan for. And those people all come around the table recognizing that if we have the same goal, we may have different ideas of how to get there, but compromise and talking and meeting each other where we're at is actually very important. I don't see another way to move forward. If you stay inside of an echo chamber, you will keep the status quo. You have to have people of diverse thinking to move forward.
Thank you. Thank you for sharing that. So you're saying that collaboration is the key.
Collaboration is the key.
Well, next question. Education in South Carolina. What are your thoughts on that? And what is your vision? What do you intend to do about the current state of education?
Yes. So I think that with education, just like some things with healthcare, we have to be mindful. If we're actually serious about moving forward, we do have to be mindful about where we're at and where we rank with states that are on either side of us in the Southeast and across the nation when it comes to things and we're talking particularly right now about education, because I like to be on the solutions side of a problem. But to be able to do that, you have to define the problem and some of the root causes for that problem and address those things, right? And so to be on the solution side of a problem, you really have to recognize where are we at right now, define that, and then decide how do we undo or fix that, or how do we take the pieces that we like of where we're at right now and bring those along and get rid of the other ones. And so the things that I think are really important with education is we need to make sure that we are paying our teachers the way that they deserve to be paid and not have any kind of lip service to that, because They have heard it for a long time, and we actually need to do it. And so I think the teachers need to be paid at a level that is commensurate with this same region, at least at the median, and have that pay raise happen for them. The other thing is that we need to provide for them as far as resources on an equitable basis so that one district does not have all of the things that they need, whereas another district lacks the things that they need in a similar fashion. That's on a different side of that bell curve. And when I mentioned that, is I had an education forum a couple of weeks ago, and we had teachers from different districts talking about how one of them had all of the PPE that they need and the other did not. Other one had all the resources they need for the classroom and the other did not. And when we see that disparity, we have to recognize why is that happening and define that and then fix it together. We have to talk about those things. And so I think that with education, first is the teachers. The next thing is providing for the teachers to be able to teach well in the classroom. And there's a multitude of ways to do that, to bring teachers in and not just attract teachers to South Carolina, but also retain them, and then make sure that the school systems have what they need for the kids in education. But then there's also the new thought about broadband access, and broadband access is no longer a luxury, and it's something that we've been talking about for a long time. But wow, did it not happen so fast that everybody recognized how important it was, because all of a sudden, like almost overnight, we went from being in school, going to the doctor, and going to work to everybody needs broadband access to go to school, go to the doctor, and go to work. And so broadband access is not a luxury anymore. Broadband access is something that is absolutely essential for everybody, like lights or water. Everybody needs to have broadband access, because that's part of forward thinking, is recognizing what the 21st century looks like and being able to meet that need as the kids have it. And that one of those things is broadband access for sure. So the teachers and making sure the school systems have what they need, and then making sure we have things like broadband access. And then I'd like to really talk about the small class sizes, because again, I know we have to know where we're coming from, and South Carolina ranks in the bottom for education, just like they do in healthcare. We have to know where we're coming from to know where we can get to. We have to address that and why that is.
Well, thank you for sharing. And with the resources in school, it's like you live in a certain zip code, you have more resources than another zip code. I remember my friend Hope Blackley and I were having a conversation on racial inequities, and we were talking about the difference when you live on the other side of the fence. And so that is all things that we have to look at as a state and in your district, I believe.
And so I think that we also know that that same thing exists by zip code for health too. If we did the racial equity report here in Spartanburg, and it was done in Greenville too, yeah, my dog would also like to take part in this conversation, apparently. I have a big blue tick coonhound. And we know that there are racial disparities that happen for life expectancy, for instance, that happen from one zip code to the next zip code, and it shouldn't be that way. And so those kind of things that happen by zip code, we know that there's a systemic problem. If it's happening by zip code, we know there's a systemic problem that has to be addressed and looked at for us to be able to move forward.
Well, now from the systemic problem, let's move on to COVID-19.
Yeah.
COVID-19 has been handled differently depending on the state. What is your vision for South Carolina and for your district regarding COVID-19? And what do you think about the way that we have handled it? And Dr. Bingham, I hate to say this, but we have 7 minutes and we have to wrap up.
Yeah, apparently my blue tick also thinks so. Sorry. Get him out here. Out. So we know that there have been serious like racial disparities that have come to light because of the health inequities that are inside of our health systems, and that has been made more evident with COVID-19. It was already more evident in any number of things, but in particular in my field for maternal mortality. We know that South Carolina has one of the higher maternal mortality rates for women, but we know that it's actually 3 times higher for women of color. So we know that there are health inequities that exist inside of our systems with COVID-19. And so recognizing that and addressing that is very important. And that takes going backwards in time. You can go forward and fix it, but you have to go backwards in time and say, well, what was the problem? And some of the problem was the fact that we did not expand Medicaid back when we had the opportunity to, so that we would have had a healthier population at this point in time, had then been getting the preventative care that they would have been able to get underneath their health insurance at that time if they had it. So without that, we know that was part of the problem. So making sure that people have health insurance so that they can get preventative care helps to set up a healthier population so that when something like this happens, which again, nobody could have predicted this was going to happen. I mean, we saw something rolling towards us late last fall, but I don't think it was the first case that was even reported until like late November outside of our country. And we didn't actually recognize it here inside of our country for a while. Even though I think as physicians, we can say we were seeing things that looked a lot like COVID before it actually was called that here in South Carolina. So with the way that COVID was handled was, I mean, very simply, it was too slowly. I mean, it was too slow. We had a number of needs that should have happened a lot faster for protecting our population. And because we did not meet those needs, South Carolina suffered. There's any number of graphs and studies that show you, where South Carolina was. And a lot of that has to do with politics. And public health is not a thing that needs to be politicized to the detriment of our population. Public health needs to be for everybody, because as we see, virus does not care what party you belong to. Doesn't matter what county you live in. It's not something that you can separate out by district. We need to have voices for public health inside of our South Carolina legislature to have these conversations inside of the room with just our colleagues and do education, but also on the outside when we're talking about how we do these budgets, because DHEC had been seriously slashed as we came into this, so that they were left unable to do the job that they want to do and are prepared to do, but without the manpower and the funding to do so. And it takes a little time to get that up. As we know, some things are now getting put into place, thankfully, and that's a very positive way forward. But we're 7 months into it. And we've had a lot of people die. We've had a lot of people who have become sick from this. And we know that has affected our minority populations in a different way. And so I'm very happy to know that we're moving forward, and I'm glad to be part of that conversation.
Well, thank you for sharing. And, nobody could have prepared for the havoc that COVID-19 has wreaked on the whole world.
That's
and
correct.
So it is truly a learning process.
Yeah.
You did mention the impact that COVID-19 had on even minority populations. And so that leads into our next question, which is we'd like to know what your vision is regarding addressing racial inequities in South Carolina.
Yes, I actually felt very strongly about making sure that this was included as part of some of the campaigning that I've done, as well as on my webpage as a priority for something that needs to be addressed, and sort of at the forethought of each of the topics that would come before me. They come before me now in the different community activities that I do. You and I, as I mentioned before, I go to the same church, and I felt very strongly about our church sort of reviving a racial justice committee that has been in existence in the past, but because of the things that have been happening just in our own community, we felt very strongly about making sure that that happened, and I was part of making sure that that came forward. But in addition to that, I have been the chair for the Poverty Initiative and the Spartanburg Faith Initiative to End Child Poverty. And that actually came out of the racial equity report that was done for Spartanburg that showed some of the inequities that happened. And we saw that although some of that was based on zip code, a lot of that boiled down to being based on things that could be attributed to systemic racism. And knowing that that was the case, we felt very strongly about addressing those things, especially as how they affected childhood poverty in the city of Spartanburg, which is really, really large. I mean, we have was almost 46% of the children in the city of Spartanburg. And so we felt very strongly about addressing that and bringing the faith community together and having that poverty summit, which you were part of, and having people talk to each other about the different ways that this can be solved. And that sort of grassroots groundswell of an effort is really important to have people talking to each other. And so in regards to the racial inequities in South Carolina, in our district, I think that having that conversation and bringing people who have that lived experience into it, not just sort of having people who think they want it to be a certain way, but people who actually have that lived experience as part of the thinking about it, is really important, because it affects us in medicine, it affects us in housing, it affects us in transportation. And I know right now there's a huge move in graduate medical education to train physicians so that they understand what bias and prejudice are and have an understanding of what their own bias and prejudice are. And I think that moving forward, that's very important to do for all institutions.
Well, thank you for sharing, and I really appreciate you coming on board. Now, I'm going to give you 1 minute to address your constituents and give them your message. So at this time, I am going to remove myself from the screen and have you share your message with your constituents.
Thank you so much, Marjy. It has been so much fun to be able to do this evening with you, and I appreciate so much that you have this humanities chat, and it's such a positive thing during the pandemic for everybody to see the different ways that people are trying to put their talents and grit and thoughts forward into our community to make it a better place and to talk to each other. I really appreciate this, and I appreciate the opportunity that you extended to host me on this. It means a lot. I also wanted to express to my constituents how excited I am to be running for the South Carolina State Senate here in District 12, to be a physician voice for you in the South Carolina Senate, and not just for District 12, but for all of South Carolina, how much that would mean to the conversations that happen regarding public health and regarding the budgeting that happens around public health, regarding things around education, because we know where we have ranked in the past, and we know that we want to do better. And as we move forward and we come up out of this pandemic, which we will, this is temporary, right? This is absolutely temporary. And as we move forward together, I think it's really important to recognize that we're on the cusp of a new beginning for South Carolina, where we have the opportunities here that are part of just the wonderful place that we live, to have better economic growth and to have better education for our students and to have a better healthcare system. So thank you so much. I appreciate it, and I appreciate your vote. I appreciate all of the generosity that people have shown me moving forward with this campaign, and it's been fantastic, and we're excited for the next 12 days.
Well, viewers, there, Dr. Bingham's message. Thank you all for tuning in and for watching. This conversation is going to be available on YouTube. You can share it with your friends. You can share it with your network. It's also going to be available on Humanity Chats with Marjy, the podcast, which is on all the major podcasts. And so if you're going for a walk, you can listen to Dr. Bingham, and you can tell your friends too. Thank you for the opportunity that you've given us to talk with you and to you this evening. And so from Dr. Bingham and myself, we would like to say a big thank you. Tonight is a packed night. We have another guest coming up. It's Kojo Asamoah Caesar, who is the first Black and young guest candidate for Congress in Oklahoma District 1. So Kojo is coming on at 7 p.m. We're sorry we have to wrap up. Once again, thank you for listening and for joining. Subscribe, and thanks. We will see you next time.
Thanks, Marjy. Thank you all.